The CT scan must be thoroughly and carefully examined in advance of endoscopic decompression surgery. The following anatomical features should all be examined. The nasal septum. The nasal septum is assessed for deviations or spurs that may impede access, which may require septoplasty. The middle turbinate. The middle turbinate is examined for abnormalities that may impede access, such as concha bullosa, which may require debulking. The ethmoid cell systems. It is fundamental to have a three-dimensional perception of the ethmoid cell systems before proceeding with sinus surgery. Whilst looking at the ethmoid sinus layout, check for sinus disease as well. The medial orbital wall contour. Assess the position and contour of the medial orbital wall and note particularly if there is evidence of pre-existing dehiscences in the lamina papyracea, or if it projects excessively medially into the ethmoid sinus complex. The ethmoid roof. The ethmoid roof separates the nasal cavity from the intracranial cavity. It is typically thin and in some patients may slope inferiorly into the nasal cavity. The depth of the skull base can be classified according to the Keros system. The depth, slope, and any asymmetry between the sides should be assessed preoperatively with radiology to reduce the risk of breaching it and causing a cerebrospinal fluid leak. The anterior ethmoidal artery. The anterior ethmoidal artery usually lies in a thin-walled, bony canal in the skull base, running from the orbit to the septum in an anteromedial direction. The canal is on average 17 to 21 mm posterior to the axilla of the middle turbinate. Although it typically lies in a plane of the attachment of the basal lamina of the middle turbinate to the ethmoid roof, this position may vary. Its position can be identified preoperatively using various methods. The most reliable is to look for the nipple-like projection on the lamina papyracea, where the artery exits the orbit. On a coronal CT scan, this can usually be seen on the first slice posterior to the globe, where the medial rectus and superior oblique muscles can be appreciated together. The canal covering the anterior ethmoidal artery can be dehiscent in up to 60% of patients, and in 10% of patients the artery can lie completely exposed in a mesentery below the skull base. Identification of this preoperatively may prevent injury and a resultant intraorbital hemorrhage. About 4 to 9% of people do not have an anterior ethmoidal artery. The posterior ethmoidal artery. The posterior ethmoidal artery is also embedded in the skull base and is smaller than the anterior ethmoidal artery. It is usually found around 10 to 15 mm posterior to the anterior ethmoidal artery, typically around 6 to 10 mm anterior to the sphenoid sinus, but very occasionally in the anterior face of the sinus. Between 2 and 34% of people do not have a posterior ethmoidal artery. The canal is less commonly seen on CT scans than the notch of the anterior ethmoidal artery, but should be in a coronal plane in line with the anterior face of the sphenoid, or about 5 to 7 2 mm slices posterior to the anterior ethmoidal artery. Sphenoid sinus dominance. A good understanding of the pneumatization of the sphenoid sinus is necessary, as access to the sphenoid sinus will be needed for posterior medial wall orbital decompression or orbital canal decompression. The presence of septations and their insertion into the carotid artery and/or the optic nerve on the lateral wall should be noted. The presence of a Haller cell. Haller cells, or infraorbital ethmoid air cells, are present in 5 to 20% of the population, and if not noted, may mislead the operator as to the location of the orbit after the maxillary sinus has been identified. The presence of an Anode cell. The Anode cell, or sphenoethmoidal air cell, is a posterior ethmoid air cell that pneumatizes posteriorly into the sphenoid sinus. Anode cells lie superior and lateral to the sphenoid sinus and may contain the optic nerve in up to 30% of cases. The sphenoid sinus should never be entered through this cell.